What are the implications of the Omicron variant? Hi, I'm Dr. Abe, Associate Professor of Nursing at Western University, and here on What the Health, I want to make your healthcare questions clearer. With the arrival of the Omicron variant just in time for the holiday season, there have been all sorts of questions about the implications. So things like, do vaccines still work? Will there be another lockdown? Will schools return in the new year? So I've taken a bit of a deep dive into the current statistics and projections. Want to share my thoughts and speculations. I'll be clear in the video where I am sharing the actual stats and where I'm sharing my own predictions. So what do we know about the Omicron so far? Two things. We know that it is more transmissible than current variants, and the vaccine still offers significant protection. So in terms of the first point about transmission, we can see this demonstrated in a few ways. Firstly, wherever Omicron has shown up around the world, we see cases rise at an exponential rate. And we are also seeing Omicron replacing other variants. And finally, there's been some actual lab testing that has shown that it may replicate quicker in the respiratory system than other variants. In terms of the second issue around vaccines, it's really important to note that Omicron is not what we would call an exit variant. So an exit variant is one where there's been so much of a mutation that your immune system doesn't even recognize what's invading your body. And therefore, you would get no coverage. We'd have to reconstitute a new vaccine and basically start at zero with vaccination. Unfortunately, that's not the case. It still offers protection, although there's some indication that maybe less protection, particularly as many people are reaching that point where their immunity is starting to decline since their first two doses. And this is why there's a big focus on a third dose booster right now. So in terms of overall risk, though, there's been a lot of speculation about Omicron and whether it's more or less deadly than other variants. And I just wanted to note that it's actually too early for us to say, and that some of the myths that are circulating around this are based on things like comparing to similar populations. And so we've seen people comparing Canada to South Africa. But in South Africa, almost 100% of the population has some level of immunity, whether it's from pre-existing exposure or from vaccination. Whereas in Canada, we have millions of people who still have no immunity either way. And then in Denmark, we are seeing no difference in the rate of ICU admissions from Omicron to Delta. So it may end up that it is more transmissible but less virulent. But we'll see when the science comes out. And for now, we just need to continue to take it as the serious respiratory illness that it is, because we do know that it is killing people still, and it is still putting people into ICUs. Just a matter of now, like, figuring out the exact rate of that. So if vaccines still work and vaccination has been really widespread at this point in most high-income nations, why is there all this concern about Omicron? And to me, it's that issue of the matter of numbers. And that's really actually the point that I wanted to make in sharing this particular video. In Ontario, Canada, where I'm located, we had 1,800 new cases yesterday and 2,400 new cases today. There was a preliminary projection 9 days ago that we would be reaching 3,000 cases, not until New Year's. However, we're already almost there. And so Dr. Peter Juni of the Ontario Science Table has noted that we're actually on pace now to hit 10,000 cases daily or even higher before the new year. And so, although vaccination is creating an increasing separation between the number of cases and the number of severe illnesses, hospitalizations, and deaths, those aren't zero, and not everyone is vaccinated. So if we look at the stats on hospitalization right now, 1 in 82 people who are diagnosed with COVID-19 end up in an ICU. So if we extrapolate that to 2,500 new cases a day, that would be 30 new ICU admissions. If we extrapolate that out to 10,000 new cases a day as projected, we're talking 121 daily ICU admissions starting right around Christmas. And you can see that on that projection on this graph here from the Ontario Science Table. So it's worth recalling that at our peak of the third wave, which was the highest in Ontario, we had 900 COVID cases in ICU. So 121 new cases daily is going to drastically and rapidly overwhelm that. Even if Omicron is half as harmful as other variants, we're looking at 60 new cases daily. And again, that would fill up our ICUs. So if the vast majority of people are vaccinated, how could we even hit these numbers? Who are these 10,000 people? Or who are these 60 to 120 people entering ICUs? Well, the issue is 12% of our population still isn't vaccinated. And that equates in Canada to 1.7 million people. And so even if half of those people have acquired immunity from being previously infected, we're still looking at 850,000 people who are at highest risk of hospitalization. And obviously that's far too many for our hospitals to accommodate it if everyone gets sick at once. And this really is where the issue lies with Omicron, that idea of everyone getting sick at once, because it's spreading so quickly and effectively that we actually risk having everyone experience an exposure over this winter. Back in the fall, there was a German official that had stated and was quite widely quoted as saying that by the spring of 2022, everyone will have either recovered from COVID, been vaccinated, or died, suggesting that there's going to be like a full population exposure to COVID. At the time, that seemed like a lot of hyperbole. However, it's actually looking more and more prescient now. If everyone is exposed, then the real differentiator is going to be whether you've been vaccinated or not. And that's going to determine how many people are in ICUs and how many people die. So these numbers then are where we see the meaning and the importance of what's happening at this moment. So even if 12% is most at risk, only 12%, or even if vaccination increases and we're down to 10% of the population at most risk, even if Omicron proves less deadly than other variants, our hospital systems are still on track to be pushed once again to their limits. So essentially what I'm saying is that a very small proportion of a very large number is still a big enough number to matter. So we've been seeing actually the start of a rollback of some restrictions. As announced yesterday, events with over 1,000 people are going to be held at 50% capacity. And there's this all-out push to get boosters out there, to get rapid tests available to people. And so this is where I get into my own conjectures around what's going to happen next. I actually don't think that provincial governments, most of them in Canada, will do a full stay-at-home shutdown, lockdown like we had previously. Particularly in Ontario, we're going into an election year. That would be quite unpopular. However, the Science Table has suggested a circuit breaker lockdown. So I do think what we're going to see is a rollback of a number of the former restrictions that we've had previously, because the Science Table has said basically we need to reduce our person-to-person contacts by 50%. So that's a big reduction in the number of people interacting with each other. And so to do that, there's going to have to be new restrictions put in place. So for example, my own Christmas party we had booked, it was going to be 18 family members. We've canceled that. And our public health unit is suggesting gatherings of no more than 10 people. So in terms of exactly what restrictions I think will come back, I have no idea. I can't say. But I do believe that we will see further restrictions announced as we go into the holiday season. And so I think it's actually really important for each of us to already think ahead. Do we need to gather with everyone? Do we need to go to a work party? How can we keep things small and safe and use rapid testing to enhance the safety of any gathering. So, of course, the other big question that everyone has right now is schools. Are schools going to go back in person after the holiday break? And again, this is just my speculation. But I think, at least at the elementary school level, I think this decision is going to be made for us. And what I mean is that we see the highest rate of COVID cases right now in Canada among kids. And we're already seeing the impact with school closures. And so in the city where I live, there's already 6 schools that are closed right now because of the number of cases. And so I think what's going to happen with that current trajectory is that by the time we get to the first week of January, there's already going to be a huge proportion of schools that would have to be closed to in-person learning anyways, just because of the number of students who go to that school who would have an active case. So the school board's going to be in this weird situation where, do they return this limited number of schools to in-person where so many would have to be online? And so I could be wrong on this one, but I think it would be easier for the school boards to say, we're going everyone online for X period of time, and then we'll be back in person. However, they could continue to do it case by case. So they could just look at, by the 1st of January, how many cases are there amongst kids for each school, and then, decide which ones go in person and which ones go online that way. It could happen that way as well. So in conclusion, I think, to be honest, we are in for a bit of a rough time over the next month. This is happening globally. We see in Europe that same trajectory. And fortunately, it looks like they're already over the peak of their curve. And we follow them every time we've had a wave that has followed pretty much exactly the same pattern as in Europe, although our waves tend to be a little bit lower in Canada because we have broader vaccination use. So it's going to be tough. I do think the great news is that the overall toll is going to be much lower. Again, less hospitalizations, less ICU admissions, less deaths. But because of the number of people involved and the number of people still not vaccinated, the numbers are still just going to be too big that it's going to stretch our systems, and it's going to have that same cascading effect on our healthcare system, impacting other surgeries, medical procedures, cancellations, that kind of thing, stretching our healthcare workers once more to the max, and really requiring that preventative public health response of some degree of restriction to prevent cases in the first place, or just to slow the spread. So even if it does mean by the spring everyone has had an exposure, that those don't all happen in 3 weeks and that they would occur across 3 months instead. So I do believe that there's going to be a return to some restrictions. I do believe that, like other jurisdictions are seeing, we will get through this Omicron wave, but it will be a lot of people who are infected on the way to getting there.